Assalamu alaikum everyone. Today we will be focusing on forensic toxicology. This is the initial part of medicolegal aspects of poisons in this presentation. Classification of poisons. These are the outlines of the presentation. Toxicology, what is a poison? Poison versus toxin, clinical toxicology, toxinology, poisoning and its types, what is a drug, drug versus poison, laws regarding poisons in Pakistan, sources of poison, common household poisons, classification of poisons according to their nature, and classification of poisons according to their chief symptoms. What is the difference between toxicology and forensic toxicology? Toxicology is the science dealing with properties, action, toxicity, fatal dose, detection, estimation, interpreting toxicological analysis and management of poisons, while forensic toxicology is the branch of forensic medicine dealing with medical and legal aspects of the harmful effects of the chemicals on human beings. What is a poison? Before going further, poison versus toxin is a very important topic and you should know the difference between them. So I have written about poisons here and verbally will tell you about the toxins. What is a poison? Poison is either a natural or synthetic chemical compound. It is a substance introduced in the body to produce ill effect, disease or death. It may be of any origin like synthetic, mineral, animal or vegetable. It may be introduced through any route like mouth, nostril, anus, vagina, ears, eyes or by injection or inhalation. While toxin is one kind of a poison which is formed within living cells or microorganisms. These are small poisonous molecules, peptides or proteins produced by plants, animals or other organisms like virus, fungi, bacteria or protozoas. They can cause diseases when absorbed by body tissues and interact with the body's enzymes, while some toxins only cause minor discomfort and pain. Some can be deadly. Toxins are usually classified as exotoxins, endotoxins, hemotoxins or phototoxins. Clinical toxicology. It deals with human diseases caused by or associated with abnormal exposure to chemical substances. Toxinology is the study of toxins, poisons and venoms from the plants, animals and microbes. Poisons may cause either of the following poisonings like acute poisoning, chronic poisoning, subacute poisoning or fulminant poisoning. Acute poisoning. It is a rapid type of poisoning caused by an excessive single dose or several doses of a poison taken over a short interval of time. Chronic poisoning is the poisoning caused by smaller doses over a period of time, resulting in gradual worsening. Subacute poisoning shows features of the both acute and chronic poisoning. Fulminant poisoning is produced by a massive dose. In this, death occurs rapidly, sometimes without any symptoms. What is a drug? Drug is any substance or product that is used or intended to be used for the benefit of the recipient. It is used to modify or explore physiological systems or pathological states. One of the most common questions asked in toxicology is the difference between poison and drug. The main and most important first difference is the intent of the substance. If the intent behind the substance is to benefit the person medically, then we will consider it a drug. On the other hand, if the substance is taken with intent to harm, it would be considered as a poison. So main difference is the intention for which the substance is used. And the second important difference is of course the end effect of the substance. There are some laws regarding poisons. I will tell you superficially about them. First is the Poison Act. This law is regarding importation, possession and the sale of poisons. This law grants different licenses with specific restrictions like specific people to import, allowed amount of poisons for selling purpose, specific industries, institutes or personals who can buy the poisons, and specific quantities allowed to sold to any person. Another law is the Drugs Act 1976. This law regulates the import, export, manufacture, storage, distribution and sale of drugs. Pakistan Penal Code 337J. It states that hurt by any poison or any stupefying, intoxicating or unwholesome drug or such other thing with intent to cause hurt to such person. Sources of poison. First are domestic or household sources. These consist of detergents, disinfectants, cleaning agents, antiseptics, insecticides, rodenticides, etc. Second are agriculture and horticultural sources, which contain insecticides, pesticides, fungicides, and weed killers. Then comes industrial sources. Poisons are manufactured or poisons are produced as byproducts. Commercial sources contain storehouses, distribution centers, and selling shops. From uses as a drugs and medicines, wrong medication, over medication, and abuse of drugs, foods and drinks, preservatives of food grains or other food material, additives, coloring and ordering agents, and accidental contamination of food and drink. Miscellaneous sources contains snake bite poisoning, city smoke, severe gas poisoning, etc. Now we'll thoroughly talk about the common household poisons, as it is one of the major causes of accidental poisoning. Domestic poisons. Cosmetics. There are various cosmetics containing poisons. Cuticle remover contains potassium hydroxide and trisodium phosphate. Depilatories have barium sulfide and thallium in it. Hair wave lotions have thioglycolate salts, perborates, and bromates. Nail polish removers contain acetone. Suntan lotions have denatured alcohol and methyl salicylate. Baby powder has boric acid in it. Here is the list of kitchen products containing poisons. Baking powder has tartaric acid in it. Baking soda contains sodium bicarbonate. Dishwashing compounds, sodium polyphosphate, sodium carbonate, and sodium silicates. Fire extinguishing fluids like carbon tetrachloride, sodium carbonate, methyl bromide. Matches contain antimony, phosphorus, and potassium chlorate. In domestic fuels, kerosene is commonly used. Rat poisons. Rat poisons contain various number of poisons in it, which can be taken accidentally. Rat paste has aluminium phosphide, zinc sulfide and phosphide, arsenous oxide, thallium sulfate, phosphorus, barium carbonate, strychnine, warfarin, and sodium fluoroacetate. Rodin has yellow phosphorus in it, and roach powder has sodium fluoride in it. Sanitation products consist of deodorant tablets, drain cleaners, disinfectants like Dettol, and lavatory cleaners. This is the list of commonly used products in our daily life. Insecticide spray, mothballs, marking ink, ink remover, anti-rust products, cleaning solvents, fluorescent lamps, furniture polish, paint remover, shoe polish, hair bleach, toys, fireworks, chalks, and wax crayons. Garden poisons. These contain insecticides, fungicides, and weed killers. Insecticides have organophosphorus compounds and chlorinated hydrocarbons. Fungicides have lead arsenate and copper compounds, and weed killers sodium chlorate, arsenous oxide, arsenides, dinitrocresol, and paraquat. Therapeutic poisons. Antiseptics, iodine benzoin, tonic tablets, especially iron, tonic syrup, strychnine, sleeping tablets like barbiturates, headache tablets like aspirin, cough remedies like codeine, throat tablets like potassium chlorate, antidepressants, and tranquilizers. Classification of poisons. Classification of poisons first according to nature. Number 1 is homicidal poisons. Commonly used homicidal poisons are organic compounds of fluorine, thallium, arsenic, and aconite. Secondly, suicidal poisons. Commonly used poisons for suicide are opium, barbiturates, organophosphorus compounds, and andorin. Andorin is an organochloride with chemical formula C12H8Cl6O that was first introduced in 1950. It was primarily used as an insecticide as well as rodenticide. It is a colorless, odorless solid, although commercial samples are often off-white. Then comes stupefying poisons, which are especially used during robberies or roadside crimes. Consists of dhatura, cannabis indica like majun and bhang, chloral hydrate, and rofinol. Rofinol is the other name for the flunitrazepam, which is basically a benzodiazepine. Poisons used in abortion are calotropis, commonly known as milkweeds because of latex they produce, and every part of this plant is toxic and poisonous. Then comes oleanders, these are the flowers containing cardiac glycosides. Then aconite, croton, semicarpus, cantharides, ergot. Ergot or ergot fungi refers to a group of fungi. This fungus grows on rye and related plants and produces alkaloids that can cause ergotism. Then comes lead, arsenic, mercury, potassium permanganate. Accidental. Accidental consists of household poisons, aspirin, organophosphorus, copper sulfate, carbolic acid, etc. Rarely there are insulin poisoning reported cases, but these are usually due to the overdose of the insulin. Then comes cattle poisoning, Abrus precatorius, oleanders, calotropis, organophosphorus, arsenic, aconite, strychnine, zinc phosphide, nitrate. These are the common cattle poisons. Arrow poisons. In ancient times, arrow poisons were used to poison arrowheads or darts for the purpose of hunting and warfare. They have been used by many peoples worldwide and are still in use in areas of South America, Africa and Asia. Notable examples are the poisons secreted from the skin of the poisoned dart frog, Abrus precatorius, croton oil, calotropis, aconite, strychnine, curare and snake venom. Aphrodisiacs. These are the food or drink that stimulates the sexual desire. They contain cantharides, cocaine, cannabis, opium, strychnine, arsenic. Now the classification according to chief symptoms. Corrosives. What are corrosives? These are the strong chemicals that can attack or chemically destroy materials such as body tissue or even metal. Strong acids, which may be organic or inorganic. Mineral or inorganic acids contain sulfuric acid, nitric acid and hydrochloric acid. Organic acids contain carbolic acid, oxalic acid, acetic acid and salicylic acid. Strong alkalis contain hydrates and carbonates of sodium, potassium and ammonia. Metallic salts have zinc chloride, ferric chloride, copper sulfate, silver nitrate, potassium cyanide and chromates and bichromates. Irritants. Irritants consist of agriculture, inorganic, mechanical, etc. In inorganic we have non-metallic and metallic irritants. Non-metallic consists of phosphorus, iodine, chlorine, bromine and carbon tetrachloride, while metallic irritants have arsenic, antimony, copper, lead, mercury, silver and zinc. Mechanical consists of powdered glass, diamond dust, hairs. Now list of organic irritants. Vegetable, they contain Abrus precatorius, castor, croton, calotropis and aloes. Animal poisons are snake venom, animal venom, cantharides and ptomaine. Then are systemic poisons. They contain cerebral poisons subdivided into CNS depressants, CNS stimulants and deliriants. Spinal, peripheral, asphyxiants, nephrotoxic, hepatotoxic, miscellaneous containing food poisoning and botulism. That's the end of the classification of poisons. In our part 2 of this presentation, we will discuss about the postmortem appearance of the poisons. Take care. Allah Hafiz.